Bill Davenhall, you were speaking on FutureMed. You have to talk about the geonomics of healthcare. Doctors don't use geographical knowledge. They don't have it in their room, in their working office.
I'm going to do.
How could we do that? How could we really use it?
Well, you could bring this data into the medical record so that physicians are well informed of the contextual environment in which their patients reside or have lived. It's rather straightforward because the surrogate measure here is where you live. So when we know where you live, we can relate this to a whole host of other third-party information that has very geographically relevant and health-relevant information about you.
Yeah. Can you give one example why geographical information is this important?
Well, it's like when a doctor gives an order to get exercise or to walk in a safe neighborhood, and you could look at other people's data that are collected by communities and would have already known that this is not a good instruction, that either it's impossible for the patient to comply with those orders and then be able to suggest some alternatives. So it's a process of informing the physician in the presence of the patient of what they're capable of doing or not doing.
Okay. And why do organizations don't provide? Because the information is there.
Well, it's a workflow issue. It's about first of all, recognizing the information is available, and secondly, then having some IT people figure out how that information is going to flow into the workflow. So how do you get a piece of information like this into an electronic health record? It requires somebody to work on that.
Okay. And are you working on it in the United States?
Well, there are people that are working on it. My job is to inspire and inform others of how this can be done. So I provide a lot of instruction and demonstration of how it can be done, and it'll be up to other people actually to begin to implement this into workflows for physician offices.
Thank you very much.
You're welcome.